pre-med degree. Went up to St. Louis. I got a master's degree from St. Louis University in sports medicine, and then stayed and did my doctorate of chiropractic at Logan Chiropractic. Been in Louisville now for about 5 years. University of Louisville is what brought me here. Worked there for about a year, and then been out to practice. So, real quick about me, so we get kind of going. Okay. All right, so today we're going to talk about nutrition. And again, I've only got about 20-25 minutes, so this is going to be pretty general stuff. It might be some new information. I hope it is. I hope it's a good learning experience for you. I know Shannon was nice enough to print everything out and gave you some pens, so be sure to jot some notes. Whenever I talk, I don't put everything on there. I just kind of put bullet points and kind of expand from there. And I believe I'll be back next Wednesday to kind of talk a little bit more about some just really good weight loss tips. And today's going to be more about just some good generalized good nutrition. Okay, so I really like this quote, and we'll see as we get going, that a lot of the major diseases in the U.S. can actually be prevented. And so Benjamin Franklin actually said a long, long time ago, an ounce of prevention is worth a pound of cure. And hopefully at the end of this, presentation, you'll see that what we put into our bodies, what we do every day, our lifestyle, can actually prevent a lot of issues later on. So whenever we talk about the top 3 diseases, we've got cancer, and obviously cancer comes in a lot of different forms. Heart disease and diabetes. All of them are on the rise. Even heart disease in females is actually on the rise as well. And with these diseases, they can be prevented. And then I asked the question at the bottom: are they diet related? And absolutely 100% they are diet related. There is some genetics, but more research is showing with epigenetics you can actually stall that. So it's actually more diet related than anything. And here, just real quick about heart disease. So we can prevent heart disease and a lot of forms of cancer. Just one example is like pancreatic cancer. It has a very high mortality rate. And pancreatic cancer is actually tied into a diet that's high in highly processed refined carbohydrates. So a diet high in sugar. With heart disease, we're showing that it's not really it's more inflammation as opposed to fat in the diet. I'll get into that a little bit more. Actually, fat is good for us, but it's more inflammation. And so what happens is whenever we bring in a lot of sugar, our body gets very inflamed. It's more systemic inflammation. And what happens is with the inflammation, we'll say this is one of your coronary arteries. Inflammation right here, the green, starts irritating the innermost layer of this artery right here. And your body senses that. And whenever it senses that, what it does is these little green dots, those are platelets. Platelets are very sticky substances. And what the platelets do is they attack this area. And these platelets start forming all this right here, more platelets. And what happens with this inflammation is over time, then cholesterol starts binding to it because, again, the platelets are so sticky that you have cholesterol. And then what happens is now we have cholesterol out here, and then over time it just keeps building up, and restricting these arteries to where now the heart can't get any blood flow. And that's where we start getting heart attacks, that kind of thing. Even strokes, too. I mean, we have a lot of vascular issues, obviously, are related to strokes as well. And inflammation in stroke is just the same as inflammation in heart disease. Okay. So now, this is a term that I use with my patients all the time. There are 2 definitions. You've got an older, more common definition, which is more for injuries. If you guys are sports fans, you might hear of one of your players, rolls an ankle, something like that. And the 4 common signs of inflammation in the old definition, you've got a little swelling, pain, you've got some heat, some redness. Those are your 4 kind of symptoms of inflammation in that area when it comes to an injury. For the more contemporary, newer definition of inflammation, is your body. Your body is a wonderful machine. It really, truly is. And your body talks to itself. Your cells talk to themselves. So your brain actually talks to every cell in your body, but then heart cells, liver cells, cells next to each other actually talk to one another as well. And so inflammation actually decreases this ability for these cells to talk to one another. And inflammation is what causes disease. Your body has a system called apoptosis, which is programmed cell death. And so if you start forming cancer cells, okay, if there's some metaplasia where regular cells are starting to change, we start forming cancer cells. If your body is, if you're eating well, if you're taking care of yourself, apoptosis will actually kill those cells off, and so cancer doesn't form. But the inverse of that, if we're eating bad, if we're not taking very good care of ourselves, then the apoptosis actually does not happen, and so these cells continue, they regenerate, form more cells, and that's how we start getting these cancers. Okay, so we want to try to keep inflammation down as much as we can. And so let's kind of go into some proteins, carbohydrates, fats, that kind of thing. Give you some examples. Okay. So we've got good and we've got bad carbohydrates. At the top there are good carbohydrates, or veggies, fruits, legumes, nuts. Anything with a good amount of fiber is a good carbohydrate. Those are complex carbohydrates, meaning that whenever we consume them, it takes a while for our body to break those down. So we actually expend energy to make more energy. Okay. We'll talk about insulin quite a bit. Insulin is released from the pancreas. It's a stress hormone, and so whenever we bring in good complex carbohydrates, we have a very even keel release of insulin. We don't have a huge spike. Okay, so we'll have sustained energy. Insulin stays at a good level, so we don't have a lot of sugar going into fat cells, causing us to bring on adipose tissue, which is fat. Okay. Where your bad carbohydrates, your sodas, any sugar, juices, baked goods, anything that's really sugary, does the inverse of that. Whenever we bring it in, we have a huge increase in insulin because your stomach actually can absorb simple sugars. There's only a few things your stomach can actually absorb. Simple sugars is one of them. So whenever we bring those in, we have a massive spike of insulin. And so when that happens, we've got all this sugar in our blood. So insulin, what it does is it grabs that sugar and it starts putting out the cells. And so if we don't need that sugar, then what it does, fat loves sugar. And so what the insulin does is it puts sugar in the fat. And so we start gaining more adipose tissue. And so that's what's happening with that. And obviously, you know, if we can't keep our metabolism going, if insulin is being used, that's where diabetes comes into play. Okay? And on the bottom here, the glycemic index is a fantastic way to eat. If you guys have a chance tonight, maybe this weekend sometime, I would definitely Google the glycemic index, and you'll find some really great foods that you can try to eat during lunch, dinner, that are low glycemic. Okay, what the glycemic index is, it's a number scale. It's a 1 to 100 scale. 1 to 54 is considered low glycemic, whereas 55 to 100 is considered high glycemic. So your low glycemic are your good carbohydrates. So those are your vegetables, your fruits. Just a few fruits like melon, pineapple, actually high glycemic. Whereas the high glycemic are your bad carbohydrates. Okay, so your sodas, your juices, your baked goods, pretzels, any type of crackers, that type of thing, that are highly refined are your high glycemic. And whenever we bring in a lot of high glycemic food and drink, then again, that's where we start having this huge insulin spike, and we start putting on fat because of it. Okay. I'm sorry. And so here's just a few things that bad carbohydrates do. We talked about how carbohydrates actually increase inflammation in the body. When that happens, it wreaks havoc on the body. It really, truly does. And so it's going to increase triglycerides in the blood. And so triglycerides are one of our bad fats. And this is where we start getting some issues with vascularity. Whenever we have more triglycerides in the bloodstream with inflammation, that's when we start getting plaques built up, where we start getting coronary plaque, where we start getting atherosclerosis, which is hardening the arteries. We become insulin resistant. Over time, if the pancreas is being used too much and we keep producing too much insulin, we become insulin resistant. The cells can't actually absorb the sugar and use the sugar like it's supposed to, so we become insulin resistant. And that's where we start seeing type 2 adult onset diabetes. And then sugar is very addicting, incredibly addicting. I think I've got a slide that we'll talk a little bit more about that. So it creates an addiction to the sugar, so you just start wanting it more and more and bringing it more often. Okay, yeah, so here are cravings, okay? Sugar is just as addicting as anything else. Nicotine, alcohol, any type of drug. what happens, we get addicted to it because whenever we bring it in, our brain releases a neurotransmitter known as dopamine, and we get a really good feeling from it. We almost kind of get a little bit of a high from it. And so whenever we do that, our body craves that release of dopamine. And so whenever we want that good feeling, and so that's where we get the addiction to sugar. And again, it's just as addicting as anything else out there. How do we fight cravings? Is we need to start decreasing that with time. Eating well, taking care of yourself, you gotta understand it's a lifestyle change. My understanding is you guys are doing a weight loss program right now, which is great. That's fantastic. But once this weight loss program is done, then we don't want to well, okay, now we've done this. I've lost 5, 10, 15 pounds. I can start going back to my old ways. We don't want to do that. This is a lifestyle change. So we fight cravings by gradually decreasing the amount of sugar we bring into our diet. It's not easy. And I can speak from experience. My father has a really bad sweet tooth. I definitely inherited that from him. And I love sweets. I really, really do. Whenever I first started really decreasing the amount of sweets I had in my diet, it was not easy. You have cravings. But the more you really concentrate on doing that and making gradual changes, the easier it gets. Now, what I do is Sunday is basically the only day that I allow myself to have sweets. And if I want to go have Dairy Queen Blizzard, I will. But I have one cheat day the rest of the day, or the rest of the week, I should say. I'm very strict on what I eat. But it gets easier. Now, anymore, I don't really crave sugar, which is what we want. So your good carbs do the complete opposite, again, of your bad carbs. So whenever we bring in some good complex carbohydrates, again, it takes a while for us to break that down to a very even kill release of insulin. And that's what we want. So what it's going to do is also sustain energy levels. So you're going to feel better. You're going to be able to be more productive. So with energy levels, we're not going to have that huge crash like we do whenever we consume something with a large amount of sugar. And it helps out with body composition. It really helps out with more lean muscle to fat ratio. Okay, and that is what we want to do. We want to really try to get a better ratio of more lean muscle to fat. And so good carbohydrates are really important for body comp. Okay, so now our fats. Your fats should be, and if you would write this down, your fat should be about 50% of your diet. And I know that sounds crazy. It does sound crazy because we always hear fats are bad, fats are bad, fats are bad. And that's not true. That's actually wrong. And the government came out about 2 weeks ago and actually said that they were wrong with a lot of these nutritional guidelines that they're bringing out. They were actually admitting that they were wrong, which the government never does. So if they're actually admitting it's wrong, then they really truly are wrong. They're saying cholesterol isn't as bad for us, and it's true. But our body produces 85% of our cholesterol. We only bring in about 50% of our cholesterol, but through diet. But we need cholesterol. We have trillions of cells in our body. Every cell has a wall, and all those walls are made up of fat. They're made up of phospholipids. So we need that cholesterol. So we need fats in our diet. Men, as we age, our testosterone decreases. Testosterone, the structure of testosterone is cholesterol. It's fat. So we have to bring in fat in our diet. So like I said, you want about 50% of your diet fats, about 30% of your diet proteins, and about 20% of your diet carbohydrates. Preferably good carbohydrates. Like I said, it's okay to cheat on occasion, but you want to use that in very limited moderation. So with our fat, our good fats are our omega-3 fatty acids, which are anti-inflammatory. Again, that word has been brought up a lot. We want to decrease inflammation in the body. So our omega-3 fatty acids are really important to do that. And then your unsaturated fats are good too. I meant to change this for the bad fats. Your polyunsaturated aren't necessarily bad fats, but your monounsaturated are a little bit better. So I meant to change that. For the bad fats, it's your omega-6 fatty acids and triglycerides. Your omega-6 fatty acids are found, again, in kind of like pretzels. They're found in crackers, bread, pasta, that type of thing. Your omega-6 fatty acids are pro-inflammatory. So what they do is they actually increase inflammatory responses in the body. So we want to try to decrease omega-6 fatty acids as much as we can. A good ratio from omega-3 to omega-6 is about 4 to 1, but the higher the ratio, the better. I try to get mine at about 16 to 1. So we want to increase omega-3 fatty acids, decrease omega-6 fatty acids. I personally supplement with omega-3 fatty acids. It's pretty tough, to get a lot of omega-3 fatty acids in the body through diet. I know a little picture back there, that's salmon. Salmon is really good. Has got a lot of vitamin D and a lot of omega-3 fatty acids in it as well. Almonds typically have a good amount of omega-3s. But we want to really increase the amount of omega-3s and then decrease the amount of omega-6s as much as we can. And so where do saturated fats go? And so like I said, I want to break this myth. Saturated fats are good. They're good. We need that. And so I actually, and I think that the men are actually going to really love this, but I eat about a pound of bacon a week. So it's good for you. You need bacon. I eat about a dozen eggs a week. So I hard-boiled eggs, snack on them. I fry a pound of bacon and kind of snack on it throughout the week. I eat red meat all the time. And so we're finding that actually red meat is good for us. But it's the stuff we bring in with that red meat that's bad for us. So let's take a burger, for example. During the summertime, I grill out burger patties all the time. But whenever I prepare them, I put a slice of cheese and I'll maybe put like an avocado on top. I don't use any bread. I don't use buns. But that's what we usually do, right? I mean, we put ketchup, we put mustard, we'll eat it with a bun, and then what we typically order fries with as well. So that's actually what is worse for us. The meat itself is actually really good, but it's everything else that we bring along with it that is really bad for us. And so absolutely, eat bacon, eggs, wonderful, absolutely. And again, eat steaks, they're great for you. And so saturated fats is a good fat, so don't be scared of that. Okay, don't be scared. Now, protein. Again, as we talk, we want about 50% of our diet fats, the other 30% of our diet protein. Okay, protein's very, very important. What it does is it stabilizes immunity. So it's actually protein does more than just building muscle. Again, it stabilizes immunity. It makes neurotransmitters like acetylcholine. That's important. Okay, we need that. It stabilizes metabolism. It takes a while, just like complex carbs, it takes a while for the body to break down protein. And so what it's going to do, it's going to stabilize that metabolism. So we get those constant nutrients because it takes a while for that to be broken down. It helps out with hunger pains, again, because it takes a while to break down. We feel full longer, so we don't overeat. Okay, that's another problem is we typically overeat. And whenever we do that, obviously, we bring in those extra calories we don't need. What does your body do? It stores them as fat. And so protein is going to be great to really level that out. So it's important for weight management. And then it increases glucagon. Glucagon is the opposite of what insulin does. So we talked about how insulin actually takes sugar and puts it into cells. Glucagon actually takes sugar out of cells and actually puts it in the bloodstream for our body to use. Okay, so if we can increase glucagon, we typically have some weight loss with it as well, because now our body is using those sugars that were stored. Now they're actually using them because we need them, and so we burn more calories that way. So it's going to increase that glucagon, and we're not going to have that insulin release. Fiber is another really good complex carbohydrates. You get those from your fruits, your vegetables. Very important. Again, helps out with hunger pains because it takes a while to be broken down, and so we eat the right amount, the proportionate amount of food that we need. Your intestines, it's important for gut motility. Your intestines, your intestinal health is very important. It helps out with immunity. It helps with weight management and body composition. And so what fiber does is it increases gut motility. So really, for the most part, we go to the bathroom more regularly, more often, which is what we need. If we're not going to the bathroom regularly, what happens is the waste is actually just stuck in your intestines, but your intestines are always moving. It has alveoli that's kind of grabbing all that stuff. And so if we just have waste just hanging out in our intestines, we're actually absorbing a lot of toxins into our body, which is what, that's a bad thing. We don't want those toxins. And so fiber is going to help out with gut motility to make sure that we're going back to the bathroom on a regular basis. And then, the studies are showing that good amount of fiber helps out with colon cancer. So colon cancer is very painful. It has a high morbidity rate. So if we can do anything like that, if you have a little bit of a genetic background in it, increasing fiber in your diet is always a good thing. Water. Water is the simplest thing to add in our diet, and it's the most important thing we have into our diet as well. I've just got just a couple of bullet points right there, so it's only about, but I can actually probably put in about that much more, okay? 83% of our body is water, and so we have to replenish that water. So that's a very important, something very simple to add into our diet that's very important to us, okay? But if we're not used to drinking water, again, it's a lifestyle change, so you want to gradually increase the amount of water. A good rule of thumb is you want to drink about half of your body weight in ounces of water. So for example, I'm typically somewhere between 190 to 200 pounds, so I try to get about 100 ounces of water a day. If you're 150 pounds, you want about 75 ounces of water a day. So about 50% of your body weight, half your body weight in ounces. Again, if you're not used to drinking water, you want to kind of gradually do it. So let's say, for example, you only maybe bring in 20 ounces of water a day. You're a 150-pound male, so you need 75 ounces of water a day. What you want to do is maybe like the first week, drink instead of 20 ounces of water, 30 ounces of water. The following week, drink 40 ounces of water. Just kind of gradually increase that. And I've always got my water bottle with me because the best way to stay hydrated is to gradually sip water throughout the day. You don't want to pound a 20-ounce bottle of water and not have any more water again for a couple of hours and pound enough. You want to gradually sip on it throughout the day. Okay. So again, it's important for weight management. The portion of the brain that actually controls thirst is right next to the portion of the brain that actually controls hunger as well. And so I think the last that I saw was about 75% of the U.S. is chronically dehydrated. So if we're dehydrated, what it's going to do is it kind of throws everything out of whack. And so people that are chronically dehydrated typically overeat because your brain can't really sense when you're truly hungry or whenever you're dehydrated. So it gives you a false sense of, well, I'm actually really hungry right now whenever you're dehydrated. So we want to make sure that we're bringing in the proportionate amount of water. It's a natural laxative, just like fiber. It's going to be very important to kind of have just go to the bathroom easier. It definitely helps out with pain. You have a lot of synovial joints in your bodies, knees, your elbows, and so if your body's not producing synovium, you have a lot of aches and pains. If muscles get chronically dehydrated, they become very painful. So, but again, water does so much more than just that. There's just a few bullet points there.
About 2 minutes.
2 minutes, okay. I think that should be, okay, so perfect. So if we can take anything away from what we've talked about today, is we want to try to stay away from, again, refined, highly processed carbohydrates. Those are your simple sugars. Try to stay away from those as much as you can. Again, it's going to be tough. You need to fight the cravings. But once you start doing that, you're going to feel a lot better. You're going to have more energy. You're going to sleep better. And so we want to stay away from that. And again, don't be scared of fat. So be sure we're eating, again, about 50% of our diet is a good source of fat. Okay. Any questions? I know we just got probably like a minute, so any questions about any of that? I'll be here, so if you guys have any questions afterwards,
I have one. Eat more steak, correct?
Yeah. Yes, eat more steak, preferably like medium to medium rare.
More like on the roast.
Okay. You just don't want to over grill the steak, so when you do that, it changes proteins and actually becomes more cancerous than good. So more medium to medium rare.
I'll sure steak is like takes the salt out.
Sure, absolutely.
There you go.
Yes, sir.
On the glycemic index scale, I've always thought that 55 to 69 was actually medium.
Okay, yeah, it's just, I've never heard of medium, I will say that, I just know low and high. And so anything above 55, we want to kind of keep that in very low moderation. Yeah. Well, thanks, guys. I hope that was beneficial for you. And again, I'll be around, so if you guys have any questions, be sure to tell me.
Make sure you leave your quiz and make sure you sign up. So I know you're here, so thank you so much.
Wait, on the table.
Sure. Stop the recording now.
You're welcome.
That was good.
And I actually got it in 25 minutes.